nonspecific genital infections. Welcome to today's lecture on nonspecific genital infections. In this lecture, we will discuss a group of infections with similar manifestations that are not linked to a single organism. These infections include nonspecific urethritis, nonspecific gonococcal urethritis, and nonspecific sexually transmitted infections. It's important to understand the causes, signs, and symptoms, and the appropriate treatment for these infections. To begin, let's understand what nonspecific genital infections are. These infections became more prevalent in the mid-1960s, and they are characterized by symptoms that do not point to a specific causative agent. However, successful treatment is possible if both sexual partners are treated simultaneously. Now, let's delve into the causes of nonspecific genital infections. Infection of the urethra or cervix not caused by gram-negative Neisseria gonorrhoeae. Chlamydia infections account for approximately half of the cases. These infections may or may not be spread through sexual activity, making them a significant concern for sexually active individuals. Signs and symptoms in men. Moving on to the signs and symptoms experienced by men with nonspecific genital infections. These symptoms typically occur 7 to 28 days after intercourse and include a mild dysuria, which is discomfort or pain during urination, often accompanied by a mucopurulent discharge. Symptoms may be more noticeable in the morning, with the lips of the meatus potentially stuck together due to dried secretions. Redness at the meatus. In some cases, proctitis, which is the inflammation of the rectum, and pharyngitis, the inflammation of the pharynx, may develop after rectal and erogenal contact. Signs and symptoms in women. For women with sexual partners suffering from nonspecific urethritis, the female partner may develop nonspecific genital infections. The signs and symptoms in women can include vaginal discharge, and mild dysuria, which refers to difficulty or pain during urination, pelvic pain, dyspareunia, which is difficulty or pain during intercourse, possible cervicitis, which is inflammation of the uterine cervix, urethritis characterized by inflammation of the urethra, often accompanied by mucopurulent secretion. Treatment is based on bacteriologic examination, including a gram stain. It's important to note that untreated symptoms and signs may subside within 4 weeks in 60 to 70% of patients, but complications can arise. To effectively treat nonspecific genital infections, follow this procedure. The patient should abstain from sexual intercourse until cured to prevent reinfection. The drugs of choice for both sexes are tetracycline or erythromycin. However, tetracycline is contraindicated in pregnant females. In some cases, spectinomycin in the dosage of 2 grams intramuscularly may be considered. Both sexual partners must be treated to prevent reinfection and ensure a successful recovery. In conclusion, nonspecific genital infections, including nonspecific urethritis and related conditions, are characterized by a range of symptoms that can affect both men and women. Timely and appropriate treatment, as well as the involvement of both sexual partners, are key to managing and preventing these infections.